Well, good afternoon. Thank you for coming. As you know, last night, the Department of Health announced 17 new cases of COVID-19 in Florida. Florida has 51 cases, 45 Florida residents, 6 non-residents, 40 diagnosed in Florida, 5 Florida residents diagnosed and isolated in another state. Our testing totals are as followed: 221 tests in Florida pending results, 478 tests have come back negative, 1,048 people have been monitored to date that are no longer being monitored, and 365 are currently being monitored. Of the tests conducted in our county health department labs, roughly 90% are coming back negatives. Now, we have yesterday outlined a number of things that we're doing. One of the things that we are focusing on is protecting our vulnerable populations. This is a virus that has a disproportionately negative impact on folks who are older, who are vulnerable, who have an underlying medical condition. And so with that in mind, we issued restrictions on access to nursing facilities and assisted living facilities. But because we had the 11 cases, we now have 11 cases in Broward County, I'm directing Jared Moskowitz to expand the current order and prohibit all visitation to nursing homes, assisted living facilities, adult family care homes, long-term care facilities, and adult group homes in Broward County for the next 30 days. Beyond that order, I've directed the Secretary of our Agency for Healthcare Administration, Secretary Mayhew, to aggressively and continuously connect with all these facilities throughout the state, in person, by phone, whatever you need to do to ensure that they're following appropriate protocols and have a plan in place should they have an individual that tests positive. So far, Secretary Mayhew and her team have visited over 260 facilities in person. So we appreciate with that. As I said yesterday, we're committed to expanding testing capabilities in the state of Florida. We all know that there was CDC tests and everything. I wanted to make sure Florida was acting quickly on its own to do this. So I directed Director Moskowitz to purchase 2,500 testing kits that will give qualified labs throughout the state the capacity to process tests for up to 625,000 individuals. Each kit allows 500 tests, but you need 2 tests per person. So you're looking at 250 individuals per kit. Up to that amount, obviously, the tests have to be done properly. And I've also directed our Surgeon General, Scott Rivkees, to strategically distribute these testing kits to 50 CLIA-certified labs throughout the state, starting with hospitals so that testing can be completed closer to the patient. A lot of the hospitals have concerns if people are in the hospitals, then it takes 48 hours to get a test result back. If they have a lab that can do this, they're going to be able to do it there without having to send the sample everywhere. That would mean they would probably get the results back quicker. So far, we've received 1,000 of the 2,500 of the kits we've ordered. Now, this is a display. So they're not actually in there. They're being refrigerated, or they have to be kept at a certain temperature. So we do have 1,000 kits now, and I'm directing Dr. Rivkees and Director Moskowitz to distribute all of these 1,000 test kits that are here to laboratories and hospitals that request and can use them as soon as possible. The tests will be distributed with priority to hospitals in counties with the highest need, starting with Broward County, based on their increased number of cases. And so to give you a sense of where the state is in terms of testing capability, none of the folks referred for tests have not been able to get a test. We've had capacity to meet the folks who have been referred up to this point. Right now, the Department of Health at the 3 labs operating in Tampa, Jacksonville, and Miami can do a combined 300 patients per day of samples. We also have the capacity to do another 100 tests per day with a CLIA-certified labs throughout the state. The goal is to have 50 of these CLIA-certified labs throughout the state, processing about 100 per day. So that would be a good increase in our capacity should that be necessary. You also have the private sector that is stepping up efforts, Quest and LabCorp. Now, they don't actually take the samples for the test, but they process the test and come up with results. And so those are collected, shipped out every night. They test all through the night, and they're trying to get the results back within a 24-hour period. I think by the end of next week, both companies are going to be doing about 20,000 samples a day nationwide. Now, obviously, Florida will be a part of that, and so that is something that will be beneficial as well. I want to stress, if you're somebody who is experiencing symptoms of COVID-19, fever, cough, shortness of breath, and you speak to a physician and they think that you should be tested for it, then we have opportunities to do that via the Department of Health, via your doctor, via some of the hospitals. So get it done if you need to. The CDC initially, when this came out weeks ago, had linked it to different travel in certain countries. And obviously, if you've done that, that's still something that could be very significant. All the cases in Florida, the overwhelming, are all still linked to international travel. Some of the other investigations are ongoing. So that is, but you don't have to have traveled. If you have the symptoms and a doctor recommends it, then you can receive a test. And we want folks to be doing that if they're experiencing the symptoms. I'm also directing Dr. Rivkees to set up voluntary and targeting sentinel testing of additional individuals so that we have better data on COVID-19's impact, particularly among mildly symptomatic populations. I mean, these test results that are coming in are great. We put out the numbers. You know, it's, I hope, helpful for folks to see that. But there are certainly people out there in our state and throughout the country who have very mild symptoms, who may have a cough for a few days, and they're not even thinking about calling a physician or getting a test. They're just kind of going about their life. And fortunately, with this virus, for the vast majority of people, that's probably going to be the type of symptoms that they get. But we want to try to figure out if we could identify, you know, how much more prevalent it is among some of these populations which are not exhibiting very significant symptoms. Again, those are going to be younger populations and healthier populations. But I think this is a good effort to, as this thing goes more, I mean, we knew we were going to have more cases this week. There's going to be more cases next week. I mean, that's what's happening. I think some of the social distancing that's being done with reducing the gatherings, some of the other things that have been implemented in nursing homes, I think that's all important. I think that'll help. But just from the contacts based on the cases so far, you know, you're anticipating more. So we want to make sure we have the increased testing capacity, and we didn't want to wait for anyone else to do it. Incidentally, when we spoke to the manufacturer of the test kits, they told us Florida's purchased more than not only any other state, but all the other states combined. So I really appreciate Director Moskowitz getting on that issue and getting these things out. I'm also announcing today that we will be, in probably over the next 24 hours, activating certain components of the Florida National Guard to assist in our efforts to support our local communities that are affected by COVID-19. We're working on the shape and scope of that. You know, if you mobilize a physician who's actually working on this now in their community, probably not the right thing to take them out of that fight. So we're going to look to see where are the folks located now who could offer help. And it's not just physicians. You know, they have nurses, they have medics, they have a lot of other people who really could help us. And we think that if we have National Guard support, that they could help augment medical staff shortages, potentially could help expand testing resources, and even potentially setting up a field medical clinics if that were needed to be the case. So it's been, if you look at the last few days, you have sporting events canceled, all this stuff. You know, I think that it's something that is, people are erring on the side of caution in the private sector, government organizations, and I understand that and think that makes a lot of sense in many respects. But I also think that this is something that we'll be able to get through. we're going to have to do this for the foreseeable future, but it's something I think that the people of Florida will be able to get through. So I know it's frustrating to see an event canceled or to see some of the inconveniences, but I think that everyone wants to, up and down the state, the local officials I talked to, the medical professionals, the private businesses, they want a healthy environment in Florida, and so we want to do our best to make sure that this virus is not allowed to simply run unchecked throughout our society. If you want more information, our website is floridahealth.gov. It's got the updated guidance on COVID-19, and I want to thank the Surgeon General. I don't think he's rested very much over the last however many weeks and months, and we appreciate his help. So I'm going to let him say a few words, and then I'm happy to take some questions.
Thank you, Governor. Good afternoon, everybody. First, I want to begin by thanking the Governor, Lieutenant Governor, for their incredible support and guidance in this response, and also fellow agency directors. This is a massive response that is involving thousands of individuals. Again, COVID-19, this is a new virus that has recently appeared. The spread is person to person, which is why we have precautions in terms of covering your cough and some of the other measures we talked about. This is like the flu, but is slightly different than flu in terms of symptoms. The most common symptom is fever followed by a dry cough and then associated with fatigue. As the governor mentioned, most of the cases that we are seeing in Florida are related to travel internationally or to areas in the United States where we are currently having outbreaks. This is why it is very important that if you come to Florida from an international destination or a part of the United States where there is an outbreak, that you take precautions while you are here. You need to very carefully monitor your symptoms. If you become ill, you need to contact your physician or the health department to let you know. Avoid going out in large groups and avoid having contact with individuals who are especially vulnerable, such as the elderly or individuals with underlying medical conditions. The incubation for this can be up to 14 days. So if you're returning from high outbreak areas, please be cautious. In terms of where the cases we are seeing in Florida, they are coming from different areas. We have individuals from New York now. This is an area where there are some areas of community spread. Egypt, Italy, Dominican Republic, Belgium, Trinidad, and also Ireland. As the governor mentioned, that we have increased testing capability, which is very important. This testing can be taken in terms of what the test means by your physician. Your physician will place a nasal swab in your nose and on the back of your throat. Sometimes they may all have you spit into a cup, and these samples will be tested. This testing can be done at commercially available laboratories, as the governor mentioned. The specimens, though, are not collected at the laboratories, but rather at the practitioner's office. Hospitals also may have testing laboratories where these can be obtained. As the governor mentioned, the state of Florida has purchased 2,500 kits, which give tremendous capabilities, and we encourage hospitals that are CLIA certified, that have capabilities for molecular diagnostics, to participate in this. Also, in terms of medical providers, we have given medical providers information, and we'll be writing more about this. So in terms of what can we all do? COVID-19, as the governor mentioned, is being seen in many states across the country, and we need to protect ourselves for the eventuality that the number of cases will continue to rise. Practice social distancing. Avoid going to work when you're sick. If you're coughing, cover your cough. In terms of hospitals, again, wish to emphasize that hospitals continue to review their infection control practices, make sure that your workforce is protected as we're dealing with individuals who will have COVID-19. In terms of what our goals are, first, we are working to contain the spread of the virus. So if we have identified individuals who have COVID-19, we will identify the contacts of these individuals, and so these individuals will be asked to self-isolate. This way we can break the spread and chain of transmission. And I really want to acknowledge the incredible activities of the members of the Department of Health, particularly the epidemiology teams and all the other individuals who are involved, who are doing this very complicated and important process of contact tracing so we can do this. When we get to situations where we end up seeing isolated cases in the community, then we'll go to broader measures. So at this point, again, I want to thank the governor and the rest of the state agencies for their incredible response to COVID-19. Thank you.
Governor, is there community spread of coronavirus in Florida now?
I'll let Scott handle what the latest epidemiology is on these cases. Oh, Dr. Rivers.
Yes.
Good question. So right now, what we're seeing is we're able to take these cases from the investigation and identify where they are. Right now, we do not have evidence of community spread. However, investigations are underway to trace the cases back.
Governor, you were with Mayor Jimenez yesterday. Have investigators tracked back his contacts and whether he or not was in contact with Mayor Flores?
So I was told I was at minimal risk because I've stopped shaking hands and doing any of that. So I'm not getting in situations where, I'm just glad handing and then all of a sudden they say, hey, this person was here or there, and then I'm in a position where I have to self-isolate. So I've been kind of keeping a cocoon around me. I am not in any way concerned about my health in terms of contracting this virus. I don't think it represents a threat to someone like me, but I do not want to be somebody who is put out as governor for that. So we've been taking some of those measures, and that's just the way it's going to be. And so, but we were told, no risk on this given the circumstances. And I know they're looking at Mayor Jimenez, but there's nothing that would suggest that he's positive at this time.
Have you been tested?
Nope.
And you were on swabs for to test people. Where are you at with getting?
So a lot of these labs do have some. We also were able to, Jared Moskowitz was able to procure an order. So we're going to have a lot coming in, and they're scheduled to be here in 2 weeks. But we think that given where, some of the existing supplies in the labs, that the test kits that we're sending will be useful. But clearly, if you get a real spike, we wanted to make sure that we had more of the ability to collect the sample. And that doesn't have that. This is just the testing kit, not the part for the sample.
Mayor Lenny Curry expressed frustration last night on Twitter that he feels like he was finding out information via the news rather than being told. I don't know if you have a response to that.
I didn't see what he said. I mean, what the Department of Health is doing, I told them, is as this information comes in, as soon as you have the facts and it's verified, push it out to the public. I think that for them to hold it and call this person or that person, I think it ends up making it more difficult. I'd rather get the information out to the public, let the folks know, what the latest is. So they're getting this stuff sometimes late at night, packaging it and turning it around very quickly. And I just think that's the best way to do it, to try to hold it and to do some other stuff. I think we just got to get it out. So that's what I've told them to do, and they're working very quickly to turn the information around. I would also say, and they're going to continue to do that, and I think it's important, but it's also the case that this number, that number, I mean, it's important, but the things that people need to be doing are true whether you have positive case in your county tomorrow, 2 cases, or not. The hygiene, the social distancing, particularly looking out for elderly people and people with underlying medical conditions and making sure they're not being put in situations where they can be exposed. And so we definitely want to continue stressing that. Yes, ma'am.
The Senate today confirmed your Surgeon General nominee, and given the scrutiny that people are looking at the state's response, I was just wondering if you wanted to comment on the confirmation.
Yeah, no, I'm glad it happened. I mean, obviously we need it to happen. He's been working nonstop on this, and we need to keep going forward. So I thank the Senate for doing that. Yes, sir.
Any further election preps that you think need to be made, given that we have a primary coming up?
We're definitely voting. I mean, this is they voted during the Civil War. We're going to vote. I've just stressed to Secretary Lee, and she has stressed this with the local supervisors, is we need to be erring on the side of safety. I don't want people going into these assisted living facilities if you're not part of that community. It's just not worth the risk. That may mean some voters get inconvenienced who don't live, who aren't part of those communities. But to me, it's a no-brainer to err on the side of the safety of our residents. This is, these primaries, the way this has worked out, I mean, quite frankly, are not going to be cliffhangers. And so I want to err on the side of protecting those folks. But that's ultimately going to be decisions that the local supervisors are going to have to make. I think most of them understand that this is something that they should be doing. Okay, one more.
When will we see drive-through testing? When will we see drive-through testing?
I'll let Scott address that. I think that, I'll let Scott address that, when there may be a need for that. Obviously, if we have the Guard involved, that expands our capabilities on some of those things. But
Yeah, thank you. First, when we have situations where, first, I want to emphasize the fact that we're rapidly increasing testing capabilities, and emphasize that if individuals need to be tested, your physician will have the ability to do the test. If you end up having situations where physician practices become overwhelmed, then we will look for these alternative measures. Thank you.
But China's response seems much more sophisticated than ours. They're having everybody go and get a fever check wherever they go. They're sending them to fever clinics. They might not
in
have-
China, you're talking about?
Yeah.
Yeah. Well, China's an authoritarian country, so it's a little bit different. But I would just say, I think Scott, I think me, Jared, I think we're open to doing things that be effective. There are some of these things being done, like the nursing homes, the fever checks, and some of that. The problem is that you could be carrying the virus and not have a fever. You may not have developed symptoms yet, and so there's a whole host of things that you want to deal with. And if you're somebody that's been exposed to the virus and maybe you contract it, you could still test negative initially, and it takes time for that positive result. So you would be self-isolating for 14 days, even if you got an early negative. And we've had people throughout the country that have had an early negative and then later had a positive between the 14-day window. But I've told Scott, I've told Jared, whatever we can do using the resources we have to help, particularly some of the local healthcare providers, in the effort, we want to do it. The reason I wanted to increase testing capability is, to the extent you see a surge, which we obviously are going to prepare for, we want to be able to identify as many cases as you can in the state. What Scott and his team have done is when they identify these, they do the contact tracing, people are isolated. I think that has helped slow the spread of what we would otherwise have. It's very labor intensive, takes a lot of work, but obviously you need to have the individuals identified as being positive before you can do it. Thanks. We'll have more updates later.